Jonas Salk created the polio vaccine in 1955. With it, he created the most important vaccine in the modern era. He broke the barrier of not only polio, but for disease eradication, allowing for future generations to live in a safer world. This vaccine would also serve as the basis for more vaccines, helping in the expulsion of many other diseases. Salk's polio vaccine, breaking barriers of disease prevention. In the early 20th century, polio was spreading across America in a dangerous manner. While the first recording of polio was in 1789 by a doctor named Michael Underwood, the epidemic of 1916 brought polio to the forefront of the nation. That epidemic in 1916 wasn't the first in America, because in 1898 an epidemic in Vermont occurred with 196 cases. The extent of the 1916 epidemic was much larger and brought with it a frightened nation. The epidemic led to extensive research about the treatment and prevention of polio, but also came with many problems. Polio would appear most often in the summertime, during what was called the polio season. In the summer, polio could be transmitted by just touching someone who has it. This was a problem because a person infected with polio might not know they have the virus and could potentially infect anyone they were in contact with. During this epidemic, many things were implemented to try and help people. The first of these was the polio prevention team. This team tried to help anybody who was found to have polio. At their own personal risk, they would visit people with polio and give them comfort. They would also look for people with signs of polio and try to stop it before it spread to others. This team would also ask for money to donate to the research of polio. Another important invention during this time was the iron lungs. While this device helped people with polio breathe better, it greatly decreased their quality of life. Polio patients in iron lungs were forced to stay in this machine the entire day. In some cases, they remained in iron lungs for the rest of their lives. The utilization of the media, in the form of commercials, was also a new tactic implemented for polio. These commercials would include both patients along with actors to ask for donations to help polio. Throughout this terror of this polio epidemic, there were some groups of people beginning to discuss the idea of a vaccine to prevent the disease. This was a new thought because they were not widely used or manufactured vaccines at that time. This was also a move away from the other forms of prevention like inoculations. Throughout this epidemic, Jonas Salk and Albert Sabin were both trying to invent a vaccine to stop the use of the iron lungs and save many lives from this very deadly disease. Both men were born to Jewish families in the New York area and lived through the Great Depression. The race for polio prevention was a race between Salk's injection of a dead virus vaccine or Sabin's oral live virus vaccine. Ultimately, the FDA approved Salk's vaccine first. Jonas Salk's injection appeared to be the more active way to prevent polio. With this approval from the FDA, Salk was able to make the vaccine more quickly and then manufacture it to aid people in the United States. There were trials all over America testing kids at school by injecting some with the vaccine and others with a placebo that contained no vaccine. This was used to see if it was effective and safe to use. The parents of the children were not scared of these trials, because if their children could be safe from polio, it would change their lives forever. Then a disaster happened with one of the many manufacturing facilities of the vaccine. A facility in Berkeley, California by the name of Cutter made a polio vaccine that ended up containing an active virus. This active virus was injected into 20,000 people. Amongst those injected, 7,000 fell ill, 200 became permanently paralyzed, and 10 died. This disaster would be known as the Cutter Incident of 1955, and it drove many facilities away from making the vaccine for a long time. It also halted the manufacturing of the vaccine for some time. It would lead to many people becoming unprotected before the coming polio season. With most facilities closing the window for making the vaccine, Salk's competitor, Albert Sabin, was catching up with his oral vaccine. Then something amazing happened. Salk met the deadline and produced millions of the vaccine, potentially saving many people. Sabin later got his oral vaccine approved in the early 1960s. Some have said that the introduction of a second vaccine kept Salk from getting a Nobel Prize, even though he was the first to stop polio. With Sabin's new oral vaccine, Salk's vaccine was used less. Salk never came back to fame after his vaccine. He continued to engage in various infection research in California until he died on June 23, 1995. Albert Sabin died on March 3, 1993 in Washington, D.C. What some didn't expect was that the polio vaccine would change the way people treat diseases forever. Due to the lack of vaccines before, some people were not convinced that this was the way to get rid of diseases. Through the polio vaccine being such a good success, many more vaccines were made in the future. The polio vaccine was a basis of how to make a live and oral vaccine, the proper way to test the vaccine, and the most efficient and cleanest way to manufacture and transport vaccines. With the polio vaccine being a brand new vaccine and vaccines still not being popular, researchers developed a system of testing vaccines and how to quickly distribute them. While these vaccines broke down disease barriers in the US, there were still many cases of polio throughout the world. In the 1970s, a poll showed that polio was widespread in non-developing countries. Soon, a program to give the polio vaccine all over the world to kids was developed, with the help of the World Health Organization. With this new program, eradication of polio was estimated to be possible by 2000. This eradication has been complicated by countries that have not been able to afford this vaccine, and also by parents who have decided to stop providing vaccines to their children. While the fear of polio has been non-existent for a long time in the US, concerns of vaccine safety has led some parents to stop allowing their kids to be vaccinated. I spoke with pediatric pulmonologist Dr. Vineet Mahesh about the potential impact of these current practices. So, with parents not getting their kids vaccinated, do you see extinct diseases such as polio coming back?
Yeah, there are already some things that have started to come back. Measles was almost unheard of in the United States, and there have been half a dozen measles outbreaks over the last couple of years. And it's the perfect storm. You have kids who are not immunized, and then someone slips into the country legally or illegally with the disease process, and then all of a sudden it sets off this explosion of illness.
It is important to realize that polio is not totally eradicated from the Americas, and an outbreak could happen again. In addition to parents refusing to vaccinate, the vaccine is not available to many third world countries who do not have the money to give their citizens any vaccines. It is necessary to give children the vaccines they need to thrive in poor communities. Breaking a barrier is when someone achieves something that previously seemed unattainable. The idea that diseases could be eradicated was not something Salk was seeking to achieve. His goal was to stop the spread of polio. He broke the barrier of many virus-based diseases, clearing a path for future vaccines to manage diseases such as the measles, chickenpox, flu, and rabies. The polio vaccine was the starting place for the vaccine era of the medical field and brought with it the idea that some diseases could be eliminated forever.